here's my setup. I have my hand sanitizer here, my epinephrine kit. I have a white sheet and blue pen for documentation, a cotton ball, a sharps container, garbage. I have a 3 milliliter syringe, some alcohol wipes, a 25 gauge needle with a sterile field. I have a cooler with my multi-dose vial inside. Hi, I'm Amy Berg and I'm a second year medicine hat nursing student. I'll be giving you your influenza vaccine today. Can you please state your full name and date of birth for me?
Amber Dusam, September 1st, 2004.
Perfect. And can I confirm that you have not received the influenza vaccine for the current influenza season of October 2024?
No, I have not.
Perfect. And do you live, work, or go to school in Alberta?
Yes.
Great. Now I'm just going to ask you a few questions to make sure you're fit to immunize today. Are you well today?
Yes.
Do you have any allergies?
No.
Have you ever had a reaction to a vaccine before?
No.
Do you have a health condition that has required a doctor's visit recently or requires one on a regular basis?
No.
Perfect. And do you take any medications regularly?
No.
No. And are you pregnant?
No.
Perfect. Now I'm just going to go over the vaccine and influenza itself. So influenza is infection of the nose, throat, and lungs. With the vaccine you're receiving today, your body will build antibodies, which will protect yourself against influenza in the event if you get it. It minimizes your symptoms, and it will eliminate your chances of getting the infection itself. Getting the vaccine today is much safer than getting the infection itself. It's very safe. So the influenza vaccine is a quadrivalent vaccine that's inactive. So that means it has 4 strands, 2A and 2B. There's A Victoria, A Thailand, B Phuket, and B Austria. You'll be receiving a 0.5 milliliter dose. With the vaccine, there may be some symptoms, but they're usually mild and go away in a couple days. So you can have some redness or soreness of the arm where you get the injection, but putting a cool combat towel or cloth on there will help that. You also can get some influenza-like symptoms like chills, body aches, stomach aches, fever, but taking any medications you usually take for those symptoms at home can help that for you. It's also important that you stay 15 minutes after receiving the immunization today, just in the event that you might get the vaccines where the symptoms will be here for you. So today, for the vaccine, you are receiving it in your deltoid muscle, which is your shoulder. Do you have a preference of what arm?
My left.
Okay, sounds great. And do you have any questions?
No.
Perfect. And do I have your consent to give you the vaccine today?
Yes.
Great, thank you. And I'm just gonna get our station set up before we begin. I'm gonna get the vial out of the insulated bag. Make sure it's the correct vaccine, Fluzone. Check the expiry date and when it was open. Record the lot number. Make sure there's no discoloration or reticulate. Show the patient. So this is what you'll be receiving today. You'll get a 0.5 milliliter dose. Agitate the vial. Get an alcohol wipe. Wipe the top of the vial. Let that dry. Grab a 3 milliliter syringe and a 25 gauge needle. Take off the cap. Draw back 0.5 milliliters of air. Shut air in. Draw back 0.5 milliliters of sand. Flick out any air bubbles. Use the scoop method to recap. Check the vial one more time, make sure it's right. Put it back in the insulated bag. Hand hygiene. I'm just gonna locate the site. Can you roll up your sleeve for me? Thank you. And I'm just gonna locate your acromion process and your tail. Perfect. 3 fingers now. Just gonna go right here for you. Just gonna wipe your arm. Perfect. Just gonna hand hygiene before we begin. Stretch the skin. Can you take a deep breath for me? Check for flashback. Put in the sharps container. Here's a cotton ball for you. Can you just hold that there? And that's it for you. Just a reminder to stay 15 minutes after. You can just wait in here while I finish my documentation. Thank you so much.